Hi everyone, and welcome to the CP Achieve webinar today. So we'll have two presentations today, and we really encourage people to write questions directly into the chat and we'll answer them at the end of both sessions. My name is Izzy and I've got my partner Millie with us, and we are occupational therapy students about to graduate from ACU in North Sydney. We've had the pleasure of working with Dr. Margaret Wallen, an occupational therapist, and Megan Walsh, a speech pathologist, for the last 3 or so months on a project about working with people with cerebral palsy and complex communication needs as research partners. Margaret and Megan are both researchers from CP Achieve, and this project is a contribution embedded within their work.
Before we begin, we would like to acknowledge the traditional custodians and the land in which we're meeting today. We would like to pay our respects to elders past, present and emerging, and extend that respect to any Aboriginal or Torres Strait Islander people here today.
Before we get into the more meaty parts of our presentation, there are a couple of technical terms that we wanted to define for the context of our project. Firstly, we're going to be talking about people with complex communication needs, or CCN, which is a broad term to describe people with severe language and communication impairments. People with CCN often use augmentative and alternative communication, or AAC, to replace or support natural speech, and many people with cerebral palsy have complex communication needs and rely on other ways to communicate. The second term that we will use is research partners. Research partners is about involving people with lived experiences as active and collaborative members of a research project. It's not about involving participants in the research, but rather helping guide researchers to ensure that the project is safe, appropriate, and relevant to the population. Involving people with lived experience as research partners is becoming increasingly expected within the healthcare industry, and the role of patient involvement is moving from a more passive role into a much more active responsibility. Instead of being a subject of research, it's now expected that people with lived experience are involved in designing, planning, and implementing research, as well as putting that knowledge into practice. People with CCN are often excluded from research, both as participants and as research partners, leaving a significant gap in knowledge. This is likely not on purpose, but perhaps happens because of a lack of understanding or difficulty managing ethical standards and limited methodological guidance. People with CCN often require additional time to communicate, which can also deter researchers from involving people with lived experience.
Before diving into our presentation, we wanted to give an outline of what we did. Firstly, we located, reviewed, and summarised the best available literature for involving people with CCN in research. Next, we met with an advisory group of people with complex communication needs to discuss some of the strategies and considerations that we found in our literature review. And finally, we used the findings from the literature review and feedback from our advisors to create a resource to guide researchers who want to involve people with cerebral palsy and CCN as research partners. Our project was very comprehensive. Up on the slides, we have a brief outline of the methodology, or how we did it. As you can see, we started with a form of research question and literature review, then progressed to the preparation of the advisory group and facilitating it. We then moved on to collating the opinions and making a summary document from the advisory group, which led to our presentation today at CP Achieve. Our first objective was to gather as much research as possible about involving people with CCN as research partners. There's almost no literature that talks on this specifically, so we expanded our search to look for strategies for engaging with people with CCN in research in general to identify potential suitable ideas. Once we'd sorted through all our articles, we noticed two main themes: considerations for involving people with CCN as research partners, and strategies for involving people with CCN as research partners. Within our research, some ethical considerations arose. We took note of these and noticed some more common themes that we wanted to be aware of when working with people with complex communication needs. On the slides, there are a few considerations that stood out to us. It became evident within our research that people with CCN are often spoken for. Their support people, or more commonly support workers, will often answer questions for people with CCN rather than support the individual to communicate their own response. During our research, we wanted to be conscious of this and ensure that we heard the opinion of the individual rather than spoken for. Another consideration we valued in our research was giving people with complex communication needs time and outlines to prepare with. Several days prior to our meeting with the advisors, we emailed a plan and longer response questions. This gave the opportunity for some advisors to ponder and draft questions at their own choosing.
Before we move on to our strategies, we wanted to explain why it's so important to have these in place for communicating with people with CCN. As we said earlier, people with CCN may have difficulties expressing their feelings, their needs and their wants, as well as understanding other people's communication. So to facilitate the most authentic and accessible communication, we need to develop efficient and reliable communication techniques. That way we can support people with CCN, and these should also be individualized according to each person's needs.
While we were researching, there were many different ideas and strategies that came across. These are practical strategies that enable communication between researchers and people with complex communication needs. In particular, we drew upon 4 that we believed were noteworthy. We used our reasoning and the advice from our supervisors to determine which strategies would be the most useful and appropriate in this context. Many articles discuss the use of emotive faces in order to gain an understanding of an individual's view on a topic. Emotive faces were used within a scale or general selection for individuals to scale their viewpoints on the strategies presented within the advisory group. This also facilitated a very enjoyable icebreaker activity for the start of our group. We asked all members on a scale, how do you feel about Harry Styles? This was a universal, light-hearted activity that everyone seemed to enjoy. We continued to use the emotive faces strategy with the advisory group for our advisors to communicate their opinion. Adapted image selection was an impressive strategy that we wanted to explore within our advisory group. This involved presenting advisors with a large selection of images relating to a topic or question, then asking the advisors to select the images that were the most appropriate to represent their view. We thought the accessible and universal application of this strategy was noteworthy. Secondly, we included talking mats. They are a commonly used tool made up of images relating to a specific topic. The advisors are then able to categorize the images into positive, don't know, and negative sections. We found talking mats a great idea to express an individual's opinion and view on their different topics. In conversations with Margaret and Megan, we decided the effectiveness of talking mats within research partners would be useful, therefore agreed it was important to include to present to our advisors. Within the articles we read, video recording was another commonly used strategy. We all agreed this was useful as a research team. This includes watching back a video to analyse the response, body language and facial expression of advisors to questions asked. This allows researchers to watch back advisory groups and notice expressions that they may have missed. This is a useful and easy to use tool, especially in programs like Zoom that are often advisors feel comfortable consenting to being recorded. Lastly, many studies utilised the surveys in order to gather more in-depth information on people's opinions.
We hosted our advisory group via Zoom. In the meeting were 3 advisors with cerebral palsy and CCN, Margaret, Megan and ourselves. Megan played a specific role as the moderator during the group, using her expertise and experience working with the advisors to provide structure and prompting to the group when we needed it. After summarising and looking at all the literature, we prioritised the ideas that we thought would be the most useful to present to the advisors, and we discussed some key points from the literature, including some of the tangible strategies for working with people with CCN, and the advisors provided invaluable opinions on these, which we'll discuss later in this presentation. Preparing for the group was an essential part of the project to ensure that meeting in an advisory group setting went smoothly. We divided preparation into 2 separate stages. Firstly, the team met via Zoom, and Megan, who works regularly with our advisors and knows them well, provided a profile of each person, including how they communicate and any other information that might be relevant for the advisory group. Overall, we spent close to an hour and a half familiarising ourselves with the profiles and brainstorming things that might go wrong and how we can best suit everyone. This is massively beneficial as it allows us to tailor the agenda specifically to the advisors, making it more engaging, less fatiguing and more enjoyable for all involved. Once we felt comfortable with our understanding of the advisors, we were able to create a more detailed plan for the group. We made sure that we used plain English and we had visual slides including icons to support what we were saying, which was a strategy often talked about in the literature. A mixture of yes, no, or closed questions were used, as well as open-ended questions that were given to the advisors before the meeting. We allowed plenty of time for each question to be answered and tried to manage fatigue by planning regular breaks. We also ensured that our roles within the advisory group were clear, especially the moderator's role, to ensure that it flowed as seamlessly as possible.
The advisory group was facilitated on Zoom. This meant participants and professionals could join from across the country. As we said before, we started with a fun icebreaker using the emotive faces technique. With all advisors in agreement that the emotive faces were a good tool, we continued to use this to rate the strategies throughout. We presented each strategy with a plain English explanation, then asked advisors to rate the strategy from not at all, fair, good, very good, and excellent, as you can see on the slides. This was a fatigue-limiting, efficient way to understand each advisor's strategy's effectiveness. Adapted image selection and emotive faces were some of the most well-received strategies, followed by talking mats. Survey use and video recording was less well-received in comparison. We then progressed on to our pre-prepared or long answer questions. We started by asking, what should researchers do to help people with complex communication needs participate in an advisory group? All advisors agreed that researchers should know the advisors. They felt it was important for researchers or group facilitators to know how all the advisors communicate and their unique needs. They also mentioned the importance of feeling welcomed. After this, we opened up the discussion of support workers. We wanted to explore the experience of being spoken over rather than supported to communicate. Advisors recognised and identified with the incidents of support workers speaking for them. When asked on how to manage this, one advisor said, with support workers she had rapport with, she felt comfortable addressing this and putting up boundaries. However, she preferred the research team to facilitate the discussion if the support worker was new. While discussing etiquette with the advisory group, one advisor appreciated generating her own answers within the group time, while facilitators or other advisors did not stare and consciously wait for her. On the other hand, other advisors felt it was more respectful for facilitators to wait and other advisors to watch as she generated an answer. Within these open-ended questions, it became very evident that each advisor will have individual values and expectations. In order to make a group welcoming, it is important to know all advisors well. This includes understanding the way in which the individual communicates, their support needs, and their communication etiquette that they prefer.
To finish the session, we thanked the advisors for their time and expertise, and about a week later, we sent a follow-up email to find out if they enjoyed the survey and if they had anything else to say. Surveys were really highly regarded in the literature. However, our expectation of responses is probably a little bit unrealistic. 2 out of the 3 advisors responded to the surveys and answers were brief, which is likely because of the taxing nature of online surveys.
While our literature review informed strategies and made us aware of the considerations, the advisory group was vital to gain a practical insight from people with their lived experience. Being able to ask the advice of people with CCN was priceless within our project. In discussions with the advisory group, every individual is different and therefore appreciates different communication techniques, etiquette, and has a range of experiences of support people. We believe the most important thing we learned from this project is to tailor individualized strategies according to the individual's preferences and capabilities. This requires a deep understanding of the person as a whole, knowing their communication preferences and the time they need to communicate. This will take researchers time, but is essential when working with people with CCN as research partners.
Within the larger project within CP Achieve, Megan and Margaret will continue to work with the advisors and involve them as research partners, and we hope this becomes a more mainstream part of research.
We would like to acknowledge Dr. Margaret Wallen and Megan Walsh for their support and wisdom during the project. We would also like to acknowledge the advisory group members. Their input to our project was beyond valuable. Thank you so much for listening.